Hello everyone. Today we'll talk about the classification of leukemia. Leukemia is a malignancy of hematopoietic system involving the hematopoietic stem cells. The hematopoietic stem cells or progenitor cells lose the ability to further differentiate and mature and become leukemia stem cells. The leukemia stem cells proliferate unlimitedly and gather in the bone marrow and other hematopoietic tissues. This inhibits normal hematopoiesis, infiltrate of the organs and tissues. The incidence of leukemia is 3 to 4 per 100,000 in our nation. It is the first cause of malignancies mortality in people under 35 years old. The incidence between males and females is about 1.81 to 1. Between acute and chronic leukemia is about 5.5 to 1. Briefly, the incidence of AML is more than ALL, and CML more than CLL. Leukemia patients in your country are fewer than those in Europe and America, especially CLL. According to the cause and cell differentiation, leukemia can be divided into acute leukemia and chronic leukemia. While according to the cell lineage involved, it can be divided into myeloid leukemia, including AML and CML, and lymphoid leukemia, including ALL and CLL. People still don't know exactly how leukemia occurs. There are several factors it related to the pathogenesis of leukemia, including physical factors, chemical factors, biological factors, hereditary factors, and other hematologic disorders. Firstly, let's look at acute leukemia. As we just said, acute leukemia is a clonal malignant disease of hematopoiesis progenitor cells. It is characterized by proliferation of abnormal blood cells, infiltration of various organs and tissues, and suppression of normal hematopoiesis. The related symptoms include anemia, bleeding, and secondary infection. Some patients could have hepatosplenomegaly and lymphoadenopathy. There are two classification systems for acute leukemia. There's FAB classification and WHO classification. FAB means French, American, British, established in 1976. This system defines 8 subtypes from M0 to M7 according to morphology and cytochemical characteristics of leukemia cells. M0 refers to minimally differentiated acute myeloid leukemia. M1 means acute myeloid leukemia without maturation. M2 is acute myeloid leukemia with maturation. M3, called acute promyelocytic leukemia, is a special AML as it has distinct manifestation and prognosis than other types of AML. M4 is acute myelomonocytic leukemia. M5 is acute monocytic leukemia. M6 is acute erythroid leukemia, and M7 is acute maculoblastic leukemia. In the year 2001, as part of an effort to integrate advances made in the diagnosis and management of AML, the World Health Organization, we mean WHO, introduced a new classification of AML followed by a revised version in the year 2008. Later, in 2016, a new revised version was released. The WHO classification of AML distinguished itself by incorporating genetic information with morphology, immunophenotype, and clinical presentation to define 7 major disease entities. AML with recurrent genetic abnormalities, AML with myelodysplasia-related changes, therapy-related AML, AML not otherwise specified, myeloid sarcoma, myeloid proliferations related to Down syndrome, and also plasmacytoid dendritic cell neoplasms. It's almost the same as AML. FAB defines 3 subtypes including L1, L2, L3 ALL according to morphology. Of L1 ALL, the blasts are small and uniform in size. The cytoplasm are scant and nuclei are inconspicuous. Of L2 ALL, the blasts are larger, with small cytoplasm. The karyotypes are irregular or folded, and the nuclei are prominent, while in L3, the blasts are mainly large cells and uniform in size. The nucleus are round to oval with depressed chromatin. The cytoplasm is abundant, deeply basophilic, vacuous. There is 1 or more nuclei. They are vesicular and prominent. WHO system defines 3 subtypes, including precursor B-cell ALL, we call it B-ALL. Precursor T-cell ALL is a T-ALL, and also Burkitt cell leukemia. Precursor B-cell ALL, including B-ALL not otherwise specified, and B-ALL with recurrent genetic abnormalities. That's all for today. Next time, we'll talk about the diagnosis of leukemia.